Hello, everyone, and welcome to the InBizLV Podcast, the podcast for business people, entrepreneurs, and anyone who cares about business. I'm Mark Fierro. We're well into the lost days of April in Southern Nevada, and the subject that's on everyone's mind, what everyone is talking about, the question, when are we going to get back to work? There are roughly 2 weeks until the end of the government's shutdown of non-essential businesses. But what happens next? When is it safe to open up Nevada for business? Here to talk about this, the subject that is so pressing today, Dr. Laura Addis Fierro, my wife. Thank you so much for joining us today.
Thanks for having me on.
So I guess the first question is, where would we be had the governor not shut down the Strip? Where would we be today?
Well, we would have been in really serious trouble, especially Las Vegas. With our international tourism, God only knows what could have happened. I think the reason why we are seeing such smaller numbers than other states is because we did shut down. Had we not shut down, we would have seen cases probably surpassing New York's numbers.
You know, I saw a number that was so daunting. It was so kind of indicative of exactly what's going on here. At the beginning of March, there were 88 cases total in the entire United States. By the end of March, there were 1,700 cases. I take that back, 170,000 cases. And to think that New Yorkers could have been visiting without knowing that they were infected, that how strong our numbers are in Asia prior to this, for people from the West Coast, from the Washington area that was so hard hit, this could have been one of the focal points, one of the hot spots of the planet Earth, couldn't it?
It certainly would have been, undoubtedly. I hear people talking, saying, oh, their numbers are so small, and I don't know why we shut down the state, and I don't know why I can't do this, that. And what they don't realize is the reason why the numbers are so small is because Governor Sisolak did do some decisive action early on. Had we had early decisive action other places, we may not have seen the numbers that we see.
So how do we open the door? It's as weird and as bizarre, the notion of shutting down the Las Vegas Strip that night, as bizarre as that was, in some ways, that's how bizarre it feels, the idea of opening the city overnight. How do we do this? Is there was a switch one night that was flipped? Does it flip back on in a single day, or how does this work?
Can't see realistically just saying one day let's just open up business and go back to normal. It can't be that way. We still have coronavirus in our communities, and we have a lot of asymptomatic carriers, and we have many states that have not even tested the population adequately. We didn't have adequate testing. I, for one, had limited testing capabilities. I did test several patients and did get some positives back. However, there were a lot of patients that I did see that I suspect had it but did not meet the criteria for testing. There are probably thousands like that here in Nevada. And if we open up the doors just one day and say, okay, let's go back to work, all these people are going to be not reinfected, that's the wrong word. All these people will have the potential to infect people that have not yet been infected. And I think opening the doors all of a sudden would be a huge, huge mistake. I think that's going to probably be a rolling type opening, maybe starting with some businesses, smaller businesses. But I think what's going to be key in this is testing to see if we have antibodies and we've been previously exposed to this or not. And that's going to be key in allowing us to go back to work.
Is there a way to go back to work until we have a valid test? For starters, put this in perspective. You said you didn't have enough tests. There are 3 million people, just under 3 million people in the state of Nevada. How many tests did you have access to?
Did I have access to? We had 10. We have 3 clinics And the office that I work for has 3 clinics, and we were allocated 10 tests per clinic. And we see in our clinics, each provider sees close to 100 patients a week. And we have 9 providers, so that's like 900 patients being seen a week, but we were allowed 30 tests from the state. That was what was allocated to us. So we had to make some tough decisions on who gets tested and who doesn't. Fortunately, clinically, you can tell when somebody does have the symptoms, and we're able to have them stay at home, isolate, and treat them symptomatically. But if there have been more tests available through some of the private entities, however, they're still limited. We still can't test everybody. If we really wanted to safely let everybody go back to work, we would need several million tests. I did read, though, that the insurance companies are going to make available to all the people that are insured the antibody testing once it becomes available. And that's going to be key. Once we have antibody testing, we can see who has been exposed, has your immune system already beat it, and can you go back to work? There are 2 different types of antibodies that we check when we're looking for a disease. We look for IgM antibodies and we look for IgG antibodies. It's an ELISA test, and what we do is we actually are recreating a similar type virus that's a little bit different than the SARS-CoV-2. But what the testing allows us to see if antibodies in our body attach onto the virus particle. If it does, then we see that that person has already had some resistance. And what will be interesting is if somebody presents to the office with cold or flu symptoms, if I do an ELISA test on them and I run antibodies, if their IgM antibodies are positive, that means they're currently infected. If they have IgG antibodies, that means their body has seen the virus and has beaten the virus, as long as they show no current IgM antibodies. So it will be a helpful test to diagnose. It'll also be a helpful test for us to see who's been infected and who's cleared the infection. Once people have cleared the infection, those people should go back to work. And those people might actually be considered very good plasma donors to help people that are currently fighting the virus, giving them antibodies. So I think we have a little more to do before we can say, let's get back to work safely. Surely there are some industries that can go back to work. There are people that work in warehouses that are distanced from one another. There are people that can work in offices where they sit in a separate office from other workers, so maybe 2 people per office where they're 6 feet apart, but they can wear a mask and gloves while they're performing their duties. What I don't see happening is putting people in a classroom, like school, and having 30 children in a classroom, and we don't know whether they've been exposed or not, especially children, because they don't show the typical symptoms. A lot of kids might have had a little runny nose or a little diarrhea, and parents just thought it was just a little cold or something that they ate. But they might actually have the COVID virus. And if they go back to school, they can infect another child. And that child might be going home to a mother who's fighting breast cancer, or somebody who has an autoimmune disease, or somebody who is on an immunosuppressant who's had a transplant, or what have you, diabetics, heart disease people. So they're bringing this disease home to the older people who can be susceptible. So I really don't think it's safe to say, let's go back to work.
There are 2 things that are just stunning to me, and that is, one of them is the efficacy of masks. Until the last 5 seconds before we came on, I was wearing a mask. And what they have learned, what they learned in Hong Kong from the SARS virus several years ago, is that washing your hands at least 10 times a day tends to impact right around 51%. Now, these numbers come from John Laub. He has just an excellent newsletter. It's at nevadabio.org. And Hong Kong should have been slammed. In a city of 7.5 million, among the most densely populated, right at the Chinese border. Hong Kong, January, new coronavirus by travelers. And only 961 cases. This is as of Wednesday. just a few days ago, 4 deaths in the entire country because it's not just hand washing, it's masks. Masks and hand washing and gloves take your ability to bypass the disease by north of 91%, according to this article. So we have to normalize masks in order to go back to work irrespective of testing, right? I mean, that sounds like it.
Absolutely. And I think we're going to be needing to be a little judicious, and probably maybe even the next year. I think even if we clear and reach the downslope of this, after that, there's still going to be coronavirus in our community. It's not eradicated. We don't have a cure. We don't have a vaccine. It's still out there. So we're still going to need to practice social distancing. We're still going to need to wear masks and gloves. It's an unfortunate reality, but I think that's the only way we're going to be able to keep this at bay.
There have been some wonderful successes, some great stories, and one of the big breakthroughs is that they're finding what the limitations are to putting people on vents. And now they're talking about lying patients face down for at least part of their time in the hospital. And that seems to have a greater beneficial impact than putting people on ventilators, from what we read.
It does have a great impact, and the theory behind it is you're allowing different portions of the lung to aerate. And it seems to have worked well. There's a patient that was just released from Southern Hills Hospital, which is here in Nevada, and they were talking about this patient because he was a survivor out of many that they had admitted, and that's exactly what they had done, repositioned the body. A lot of times also percussion on the back, cupping type percussion like this. It's respiratory therapy, but it helps the patients to expel the secretions. If they are on a ventilator, you are able to aspirate their secretions with suction, which helps them to clear their airways. But if they're not yet intubated, we can maybe reposition them on their stomach, and that will help them to drain their lungs, clear and expectorate.
I keep hearing the same thing, and I just hate for an opportunity to go by. There are people who are so horribly ill-informed. I saw something in the newspaper today that basically said this is a flu. This is a version of the flu. Well, you know what? For somewhere around 80% of the population, it's some version of the flu. For the rest of them, it carries the possibility of death. What's the death rate from this? Is like 2% or something like that for those people that really truly catch the symptoms. It's just a horrible injustice, the lack of information. And I don't know who is out there spreading this, but it seems to be ongoing. And I would just warn, what would you say to somebody who says this is just another version of the flu?
Well, I hear that a lot. And if you look at social media, you'll see that all over the place. And it is just like a flu for some people. However, it really isn't. This is much more virulent than the flu. It's much easier to catch than the flu. And this virus replicates much quicker. So when people who are misinformed and they're saying it's just like the flu, they just don't understand the science behind it. And notwithstanding science, let's just look at the facts. Have you seen them stacking up bodies in morgues and in churches and in trucks and trailers for the flu? No, this has never happened before. We can't keep up with it. We don't have a cure. It's not the same thing.
I would call anyone's attention who thinks that this is the flu to the New York Times over the weekend. The images of trenches being dug outside of New York City for unidentified bodies that will not be buried in coffins, that are simply wrapped and placed on top of each other in mass graves into the ground. I don't remember the flu ever doing that.
Nope, never happened. And a lot of the guidelines here in Nevada, we're not even allowed to bury them. The guidelines have been sent to us early on in this pandemic, and it was clearly stated how we were supposed to fill out the death certificates. It was also clearly stated that the bodies would need to be cremated. to prevent exposure to people in the funeral homes, and I assume elsewhere, maybe people visiting, I don't know, but their cremation is mandatory in Nevada.
So there is a flip side of this. We're well into this. People are learning how to deal with it. It seems like the crazy crush of hoarding that was going on with all groceries across the line has passed us. But what's really telling is that as terrible as everything that happened in New York was, there are now more people who are leaving the hospital, that are leaving in intensive care, that are going in. And that, to me, says that at least some part of America, they've reached the top of that curve.
Yeah, and I was happy to see in today's local newspaper in Nevada, I think it was 1,031 people have successfully survived corona and have gone on with their lives. So that's a positive. I like to see the positive things too. That's important for us to keep ourselves looking forward and moving forward. However, I do want to say one thing. I'm concerned though, the last couple of weeks, if you notice the first week, everybody was social distancing, wearing masks. They're not doing it anymore. A lot of people are getting lax. They're getting a little relaxed. They're thinking, okay, it's not that bad. I'm not needing to wear a mask. When I go into the supermarket with my mask and gloves on, I can tell you 50% of the people there don't have masks on. That's scary. And they're just relaxing and forgetting that it's a serious situation out here.
That 170,000 number could happen overnight unless people learn. And when they do, learn, you look at these Hong Kong numbers, and I would hope that a lot of people go to this nevadabio.org to look over these numbers, because it is so confirming that what Hong Kong did, the use of a mask, hand washing, and gloves, changes everything, and that's what could safely allow Nevadans to get back to work. There is an answer, we just haven't learned that lesson yet.
You're right about that. And the quicker we all get it, the quicker we'll all get back to work. And I'll tell you, that's why I'm doing telemedicine. I've been doing 100% telemedicine for the last 2 weeks. I'm trying to reduce the risk of exposure to people that aren't sick, that are just trying to get regular routine medical care. I'm also trying to reduce the risk to the patients themselves that are sick, because having to get out of bed when you're sick, the last thing you want to do is get out of bed. You have to get out of bed, get dressed, get in the car, drive across town to your doctor. Maybe it's around the corner, but probably you're going to stop at the supermarket on the way because, gee, I do need an extra this or that. Or maybe stop at Burger King and get a bite or something. Then they're on their way to my office. But meanwhile, they're getting sicker. Their immune system is getting run down, getting up and doing things. You need to be home resting, drinking fluids. And if you're not that sick, of course. But people coming into the office is not a good idea. And I've been doing a lot of this telemedicine, and the patients love it. The patients that are healthy are thankful that I'm doing it. The patients who are sick are thankful that I'm doing it. It's a win-win for everybody. It reduces the risk to our employees in the clinic. It reduces the equipment that we need. We don't need to use masks. We can save those masks for the hospital workers that are right there with them and the patients in the front lines. So I think it'll reduce the use of unnecessary equipment that we can save for people that are critically ill, and it'll allow people to stay safe at home. That's a big thing, with also continuing us to stay healthy in this situation.
You would think that the insurance companies would be beating down the governor's door, state officials' door, saying that you have to mandate that there's only telemedicine for diabetics that aren't in need of a face-to-face meeting. The idea of a diabetic going into a clinic to sit across the way from somebody who's there because they think they have coronavirus, in what parallel universe does that make sense?
But I'm not sure. Well, I can't speak for anybody. The insurance company is lobbying the governor. I hope they are talking about it. But what I can say is the insurance companies are telling us And every time I open up my computer to get online to do my telemedicine, the first thing that pops up on the application that I use is go telemedicine, save your patients, sign up now. But the insurance companies are encouraging us. Actually, Medicare, CMS is encouraging telemedicine. Medicare has now, as of March 6th, allowed healthcare providers to bill at the same level that they had been billing for inpatient visits. Not inpatient, in-office visits, I meant. And by doing that, it's encouraging to have more healthcare providers do telemedicine. And they even said in their most recent statement on March 20th, they want most doctors to do telemedicine. So I'm doing what's recommended because I think that I'm still going to be able to see patients. I'm still going to be able to have an income. And most importantly, we're going to keep everybody safe.
Well, thank you so much for taking the time to join us today. And yeah, I know that you were right there for your patients, so it seemed an opportune moment for you to join us. And
I was here in front of the computer anyway, so it was great.
It worked out just
Thanks for having me on.
Thank you. Time for us to wrap it up. I want to sincerely thank Dr. Addis Fierro, my wife, for joining us today, and to all of you out there who have a business, have the entrepreneurial spirit in your heart, or just care about business here in Southern Nevada, remember to like and share InBizLV Podcast on Facebook. You can also catch us on YouTube, iTunes, or Stitcher. If you know of an interesting business story to tell, you can reach Fierro Communications at 702-385-7300. Make it a great day. See you out there in the deal stream.